Hey everybody, it's Matt Shu from Upright Health, and today we are going to talk about the importance of feeling the right muscles work. And I'm going to demonstrate to you just how easy it is to use the wrong muscles or to be unable to use the right muscles when you're doing a hip exercise. So this comes up all the time. I actually just had this happen today, so that's why I'm making this video. So I have had a client in this morning, and we had him sitting in this position, so in the kind of the pancake splits position where you have your legs out. And I didn't have him go like super wide or anything. We just had him kind of like here. So it's a little bit more than 90-degree angle between the two femurs. And what we were trying to do was get him to be able to actually fire his quads in this position so that he could lift his leg up. So if you want to try this at home, you're more than welcome to. You just sit down just like this, put your hands behind you, and I would suggest that you actually lean back a little bit to try this out. So once you're leaned back, you're just going to fire your quads up, you're going to tighten them up, and you're going to lift your leg up like that. Now, some of you may find that pretty easy. I know some of you will not find that so easy. Some of you will find it just to be a medium difficulty level, okay? So you're just trying to lift the leg up here while keeping the knees straight. Now, for those of you who found it easy or medium hard, you're going to do something to make it worse. So you're going to prop yourself up even more. So you're sitting up nice and tall, nice and straight. Then you're going to fire the quad, and then you're going to lift the leg up. So many of you now are saying that is impossible, right? You're going, what the heck, man? You can't do that. That's impossible. And I will tell you this, it is possible. This used to be even harder for me, but I have been actively working on trying to improve this because it was a piece of range of motion that I realized was pretty difficult for me. But it's well within your normal anatomical range of motion. It's just that using the right muscles to do it can be pretty hard. And the illustration here for you is just that slight angle change. If you lean way back, if you lean back, you can get huge range of motion. If you lean forward, you can still potentially get pretty good range of motion, but it's harder because you have to use muscles in a different way at a slightly different angle that makes it much more difficult. So I'm showing you if I twist this way and I plant my hands, it actually makes it easier for me to lift that leg up. But if I turn this way and I try to do the exact same thing, the exact same range of motion, much harder. It requires a lot more mental effort. And that's what we were seeing with my client this morning as he was here. We had him lean back, already had a tough time lifting that up. And then just shifting forward, it was like he couldn't even talk to the correct muscles. Those muscles just wouldn't fire, and it took him a little bit of help. We had to actually just lift his leg up a little bit and then have him eccentrically control it back down. So it's important to recognize that little angle changes, little positions can make it really hard for you to activate these muscles in the right way. And that's what makes retraining your hips so complicated. Right? If you have range of motion problems, there are a lot of different variables involved that can make it hard for you to actually do what you're trying to do. If you think about what that means in the context of the normal kind of medical approach to hips, what you should realize is that nobody is generally working on helping you retrain your hips to do things in funny ranges of motion, right? Most things are just sort of front, back, side, side. And then many times there's no rotational component. There's nobody trying to see if you can do things like that, where you're just sort of winding around and being able to control your hip in multiple positions. And it is important to be able to control your hip in multiple positions so that your other more easy motions are smooth and comfortable. So I do recommend trying this out if you're looking for something difficult to add to your training routine. Of course, if you feel like this makes things for you worse, then don't do it very often. But if you feel like this is a good challenge and it results in an improvement in your comfort levels and functional range of motion, then absolutely go ahead and add it. So, again, you can set it out like this, lift up. If you want to make it harder, come forward, go like that. If you need it to be easier, bring your feet in more, right? And then you can start practicing in this position. Another little thing that you can do to make this harder is actually point your toes. So if you're out here pointing the toes, it will make that more difficult. So a couple ideas for you. Doing these, you probably do sets of 5 to 10. Just practice getting that range of motion, practice firing up those muscles. It should be a good little challenge to kick in some of those muscles and teach them to fire when you want them to fire. So I hope that gives you some ideas, helps you improve your understanding of just how complex your body is and how easy it is for things that go wrong, quote unquote. And I hope you remember that pain sucks. Life shouldn't. If you like this video, be sure to subscribe. Be sure to check out some of our other videos. And you can always head over to our website and check us out and see what our do-it-yourself programs can do for you.